Good afternoon. My name is Shelley, and I will be your conference operator today. At this time, I would like to welcome everyone to the Nurses Building a Culture of Health Funding Opportunities at the Robert Wood Johnson Foundation conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star and the number 1 on your telephone keypad. And if you would like to withdraw your question, you may press the pound key. Thank you. Beth Toner, Senior Communication Officer of Robert Wood Johnson Foundation, you may begin your conference.
Wonderful. Thank you so much, Shelley. And first of all, before we get started, I want to thank each and every one of you for your patience as we experienced some technical difficulties today. I'm glad that you hung in there with us, and we hope to make it worth your while. So before we go too much farther, I want to mention that we are recording today's webinar. So if you miss a section or you want to share it with a colleague, you can find the recording in about a week or so at www.campaignforaction.org/webinar. And as Shelley mentioned, we'll be taking live questions. At the end of the webinar, you'll also be able to submit questions via the chat function. Be sure to send, if you use the chat function, be sure to send that question to everyone. So I want to introduce myself briefly and along with my co-host, and then we'll do a quick review of the agenda. As Shelley said, I'm Beth Toner. I'm Senior Communications Officer at the Robert Wood Johnson Foundation, supporting both our nursing work as well as our leadership work. I'm also a registered nurse, so I'm excited to be co-hosting this webinar today with Sue Hassmiller, who is our Senior Advisor for Nursing. She's going to present shortly. She is a great colleague and also a fantastic mentor. So I want to walk through today's agenda very quickly. We've already had our introductions and logistics. Sue is going to share about the Foundation's vision for a culture of health, and I know that each and every one of you on this call today is also working toward a culture of health. So I'm grateful to Sue for sharing that. Sue will walk through RWJF's 4 primary funding areas, as well as talk about our Culture of Health Prize. I will share about our leadership development and research evaluation and learning programs. I'll show you how to access funding and leadership opportunities via rwjf.org. And as I mentioned, then we will turn to Q&A. Now I'm going to turn it over to Sue to talk about the vision for a culture of health. Sue?
Thank you, Beth. So let me tell you about what we mean when we say culture of health at Robert Wood Johnson Foundation and with the campaign. For us, building a culture of health means recognizing that health is an essential part of everything we do. Culture filters every aspect of our life. It's what we feel and care about. It's how we learn and teach, and it's how we relate to one another. Now, picture of being as healthy as you can, be as part of everyday culture, baked right into the very core of our existence in America. What if claiming, reclaiming, or sustaining health was a priority for everyone in this country? No matter how much you earn, where you live, what you do, or where you come from, and you are able to surmount barriers and tackle the social determinants that block you from being as healthy and well as possible. That's what we mean by a culture of health, and we are striving to build a national culture of health that will enable all of us to live longer, healthier lives for generations to come. Health means something different to each of us, but we all know one thing for sure: being as healthy and well as we can be helps us to lead more productive, prosperous lives, and that is something we should all value. And as Beth mentioned, the idea around building a culture of health is not new, nor owned by the Foundation. It is a vision we hope to share with partners and people like you who are working towards it every day in your communities. So, for its part, the Foundation characterizes, next slide. Okay, there you go. For its part, the Foundation characterizes its work to build a culture of health around 4 major themes. I'll share them with you now so that you can see where you might find support and resources for your important work. One theme is healthy children, healthy weight. Here we focus on enabling all children and their families to attain their optimal physical, social, and emotional development and well-being. An example of work we have funded in this area is a grant to Penn State University to study how to promote social and emotional learning in preschool. Next slide. Another theme is transforming health and healthcare systems. Through this theme, the foundation helps catalyze fundamental changes in health and healthcare systems to achieve measurably better outcomes for all. Under this theme, we fund a project we call Open Notes, and it's where we explore how opening physicians and nurse practitioner notes securely to patients helps make them true partners in their own care. We also have the Healthy Communities theme, next slide, in which we work to help create the conditions that allow communities and their residents to reach their best possible well-being. Under this theme, we fund projects like the work that examines how your zip code is tied to your life expectancy. I know you've heard a lot of you have heard me talk about that. Also within this theme is our Culture of Health Prize, for which your action coalitions might be interested in applying. Before I move on to the last funding area, I'd like to tell you more about the prize and some of the prize communities. So the Culture of Health Prize recognizes the trailblazing communities that are weaving health and well-being into everything they do, successfully connecting the dots among jobs, education, housing, safety, transportation, and health. Communities that are bringing partners together to implement solutions that put better health within everyone's reach. By finding these strong examples of communities and leaders that are building a culture of health, the foundation can learn from them and share lessons with others. So what's the eligibility? The prize celebrates what communities have done as well as how they have done it. And the 6 criteria that serve as the lens through which all communities are evaluated include defining health in the broadest sense. I think we're still on the last slide, I'm not sure. Sorry. Defining health in the broadest possible terms, which means using comprehensive strategies to address the many things that contribute to health. Committing to sustainable systems changes and policy-oriented long-term solutions, which means making thoughtful, data-informed policy, programmatic, and system changes that are designed to last. Number 3, creating conditions that give everyone a fair and just opportunity to reach their best possible health, which means intentionally working to identify, reduce, and ultimately eliminate disparities in health in collaboration with those most affected by poor health outcomes. These 3 are weighted, the ones I'm going to mention now, coming up, are weighted more heavily, than the next 3. So the ones I mentioned are weighted more heavily. So let me continue with 4, 5, and 6. Harnessing the collective power of leaders, partners, and community members, which means individuals and organizations across sectors and disciplines are all working together to provide everyone with the opportunity for better health. 5, securing and making the most of available resources, which means adopting an enterprising spirit toward community improvement. And lastly, measuring and sharing progress and results, which means beginning with the destination in mind and commitment to measuring the quality and impact of coordinated efforts. And it's also important to emphasize that the prize honors the work of whole U.S. communities and not the work of one organization. Even if one organization primarily completes the application to be competitive, it is imperative that prize applicants keep a community-wide focus in mind throughout the application process. Okay, now we're on the right slide. Each year, RWJ selects up to 10 winning communities. Winners receive a $25,000 cash prize, have their stories and successes celebrated broadly to inspire others toward locally driven change through customized communication materials, engage with other national and community leaders as ambassadors for building a culture of health across the nation, and become a part of a growing prize alumni network. And I think it goes without saying, if you do win one of these prizes, even though the $25,000 is not $1 million, just the fact that you're affiliated with RWJF and receive this prize tends to bring in other money as well. So the timeline. Applications are closed for 2019. Finalists will be announced March 2019, and the 2019 prize winners will be announced fall of 2019. Next slide. But, so anyways, the idea is to get prepared, right? So there are 39 RWJF Culture of Health prize-winning communities across the country now, and you can see where they are, and maybe you'll want to, connect with one of these. I hope so. I do try to make those connections between the action coalitions and the prize communities. I've done that quite a bit. Prize communities span 24 states and include 5 Native nations. There are winners across the full range of population size, rural and urban, and everything in between, all with different physical, economic, and demographic characteristics and challenges. So to learn more about the prize, application process, criteria, and previous winners, do go to rwjf.org/prize. So the last funding area is our Leadership for Better, next slide. Thank you. The last funding area is our Leadership for Better Health program. This theme accelerates the development and engagement of leaders with diverse backgrounds and experiences to building a culture of health. I'll turn it over to Beth now, who is the communications officer for these programs, to tell you a little bit more. Beth?
Thanks, Sue. As Sue mentioned, one of our funding areas is Leadership for Better Health, under which are our leadership development programs. Across all of these programs, participants receive high-level skill development, mentoring and advocacy, social innovation, equity, and other areas. They build a wide network of contacts and collaborators from across the country in fields they may not interact with otherwise. Many of the folks in these programs tell us that one of the most invigorating aspects of the programs is interacting with folks that they might not otherwise get a chance to interact with. Participants in these programs also receive annual stipends, and some programs even provide additional project funding. And rather than having to relocate, like some fellowships require, you can participate from your own community and stay in your jobs or academic programs, collaborating virtually and through several in-person gatherings. This enables you to continue creating real change in real time in your home community, yet continue to get this support. So let's take a quick look at these programs one by one. Next slide, please. So the one that may be of interest to many of the folks on this call is Clinical Scholars, which, by the way, opened up for applications today for 2019. Clinical Scholars is for health professionals from all disciplines who want to extend their influence beyond the clinic and into the community. They work together in interdisciplinary teams. That means that there has to be at least 2 kinds of clinicians on your team, and we hope more. Clinical Scholars Fellows increase their ability to use their voice and skills to innovate and lead in both their workplace and their community. Teams also receive grant funding up to $525,000, that's for a team, over the lifetime of the program to support participation in the 3-year program, meaning team members gain the benefits of top caliber leadership development at no cost to themselves or their institutions. Next slide, please. Interdisciplinary research leaders also opened up for applications today. This is a 3-year program for teams of 3, 2 researchers and 1 community partner, which could be a nonprofit leader, a community organizer, a faith leader, business owner, or any other local leader. Each team takes on a project to improve health and equity in their home communities. Across the wide range of topics and approaches in play, the shared characteristic in our teams is their commitment to using engaged research. That means research done in collaboration with the community and applied in real time to create change. So we're not looking at 6 years of peer review here. We are wanting to work with community members here and apply that change as they learn. It provides a powerful transformative journey for fellows that increases knowledge, action, impact in their fields and in the communities they serve. Each IRL team member receives annual support of $25,000 and a one-time research project grant of up to $125,000 $125,000 for the team. That's $125,000 for the team research project. In each cohort every year, the teams have to propose a project that deeply engages the community, create actionable results, and address one of two annual themes. So for the call for applications that just opened up today, there are two themes that the proposed team members must apply under. One is community development and health. The other is clinical practice, social services, and health. So the two themes, again, are community development and health, and number two, clinical practice, social services, and health. You can learn more about these themes in this year's call for applications, and I'll explain to you how to get to that as we move toward the end of our call. Next slide, please. The last program that opened for applications today for this year is Culture of Health Leaders. What's exciting about Culture of Health Leaders is that it's for emerging leaders from all sectors and professions who are highly motivated to explore new solutions, challenge existing systems, and collaborate across sectors to tackle the root causes of health inequities in their home communities. So this means you don't have to be a clinician, you don't have to be a researcher. We have performing artists in this program. We have ministers in this program. We have firefighters in this program. Over the course of 3 years, participants in Cultural Health Leaders master 4 key areas of leadership: mastery of self, relationships, environment, and change. They get to join a national network of like-minded thinkers and doers, and as with the other programs, receive high-caliber executive coaching and support in the design and implementation of a strategic initiative in their home community. Culture of Health Leaders also receive an annual stipend of $20,000, and we do indeed have several nurses in this program. One is the first woman and first nurse practitioner to own a women's health clinic in her rural Utah community. Recognizing she can't do it alone, this leader has forged powerful collaborations with public agencies, local education institutions, and the health and business communities to increase her impact and ability to better the lives of women and girls in her community. Next slide, please. This next program, Harold Amos Medical Faculty Development Program, which was previously known as the Minority Medical Development Program, opens on February 7th for applications, so coming up fairly quickly. This program was created to increase the number of faculty from historically disadvantaged backgrounds who can achieve senior rank in academic medicine, dentistry, or nursing, and who will encourage and foster the development of succeeding classes of physicians, dentists, and nurse scientists. The program defines historically disadvantaged to mean challenges facing individuals because of their race, ethnicity, socioeconomic status, or other similar factors. Each Amos scholar selected, up to 10 each year, receives an annual stipend up to $75,000, which is complemented by a $30,000 annual grant to support research activities. Each scholar studies and conducts research in association with a senior faculty member located at an academic medical center, dental school, or school of nursing. Scholars are expected to spend at least 70% of their time in research activities. And again, applications for this program open on February 7th of this year. Finally, next slide, please, is the Health Policy Research Scholars Program, which is not open for applications this year, and I'll share more in a minute about that. It is for second-year doctoral students from fields that have a direct impact on health policy, including economics, political science, ecology, sociology, and many others. These are scholars who want to apply their research to shape health policies that reflect and respect the diversity of our nation and improve health. This program, again, is for people from underrepresented or disadvantaged backgrounds. We're looking for candidates not just from major institutions, but also smaller schools, rural schools, minority-serving colleges and universities, and other programs that may be less likely to hear about opportunities like this. This year at RWJF, we're selecting a new National Program Center for Health Policy Research Scholars, which is the organization that will oversee the program. For that reason, we're not recruiting this year. but applications will reopen in 2020. And in 2020, because we are not recruiting this year, we will accept up to 60 rising second and third year doctoral students to allow for the folks who didn't have an opportunity this year. Okay, next slide, please. So I very quickly want to also highlight for you our research, evaluation, and learning signature programs. We have 4 of them. Next slide. One is Evidence for Action. This program is open for applications on a rolling basis, which means it never stops. Evidence for Action funds rigorous investigator-initiated research on the health, well-being, and equity impacts of specific interventions. Of our 4 research programs, this is probably the broadest. E4A does not have topic or issue priorities, can't be funded for longer than 36 months, but there's a wider range of budget limitations. As I said, the call for proposals is open and rolling. You start by offering a letter of intent. And this program also offers some technical assistance to potential applicants, so keep that in mind. Next slide, please. So here you'll see the website for E4A. Is this program right for you? Researchers, advocates, organizers, you can be in public or private sectors. And again, I want to point out that it doesn't have to include folks who are directly involved in health. If it has an impact on health, your research could be eligible for this program. Next slide, please. So this is Health Data for Action, and this is a fun program. It is currently closed for applications. We just closed out applications, but stay tuned for the next round. What's neat about this is it provides access to proprietary data sets that folks could not really afford otherwise out of pocket. For instance, in the last call for proposals, the grants allowed researchers access to data from Athena Health. So we make the data, the applicants propose research and the research that they would do with that particular health data set, and then if they are accepted into the grant programs, then they have access to that proprietary data set, which, as you know, can be quite pricey to access otherwise. Next slide, please. Is this program right for you? You can check out the website listed here on the slide, but it's for research and practitioners in the public and private sectors. And if you're already working with those specific data sets, you are not eligible for that. All disciplines, again, are welcome, not just health. Next slide, please. So our third signature research program is Policies for Action. So again, as the name connotes, it is focused on actionable evidence regarding how policies, laws, and other regulatory tools can support a culture of health to improve population health, well-being, and equity. Next slide, please. This program has an annual call for proposals, and I believe the next call for proposals will be sometime in the spring of 2019. I encourage you to take a look at the website. That is the best place to go to see some of the research the program has funded in the past, and it can give you a sense of what might make sense when the next call for proposals opens up. Again, it should be research designed to inform policy, action, innovation, or change. You see some of the areas in particular we're interested in: education, employment and training, criminal justice, housing. We've had a lot of great work around housing, and that's been particularly encouraging. Okay, next slide, please. Our last signature research program is Systems for Action. So this program is designed to expand beyond healthcare and public health systems. So really looking at how do we align the delivery and the financing systems in medical care, public health, social and community services. How do we align those systems in a way that helps improve health and well-being and reduces inequities? Next slide, please. So this gives you a sense, is this program right for you? And this is very much a research-focused program in terms of looking at how we align systems and services. You can see some of the things that have been looked at in the past. I encourage you to take a look at the Systems for Action website to get a sense of what we funded in the past and what we might fund in the future. Next slide, please. So, deep breaths. We've covered a lot of information in the last 20 minutes. It's hard to know in a very short webinar what is right for you if you think about in terms of where you're going with your work or your research or what you're interested in. If you're thinking about either our leadership development programs or our research programs, a great place to start is something we call our program finder. You can find that, and this will be listed on the slide at the end, but I'll give it to you now. It's www.rwjf.org/program finder, all one word. So next slide, please. I'll give you a look at what the program finder actually looks like. So once you go to that URL, this is what you'll see. Here you can select programs based on their attributes and get a side-by-side comparison. You can see at a glance whether the program is for teams or individuals, as well as where you are in your career and what an ideal candidate might look like. You can also see the funding amounts and the length of each program. Once you've gotten to a program you think is interesting, you can click through for more information about that page. Now I want to show you where to find all our funding opportunities. Next slide, please. So this is what our funding opportunities page looks like, and this will also be listed at the end. This is where you will find open and upcoming calls for proposals. So I mentioned that clinical scholars, culture of health leaders, and interdisciplinary research leaders opened today for calls for applications. If you go to this page, you will find this. You will find the open applications for that. Once you find the program on the funding opportunity page that you're interested in applying for, you click on that link. It will take you to My RWJF, where if you have not registered in the past, it will give you an opportunity to register using your username. You'll create a password, and then you will be able to sign into our online application system to apply. If you've already applied for a grant in the past and have used our system, you know how to get in. One thing I really, really, really want to encourage you to do, you'll see that circled your email address field. If you haven't done this already, sign up for our email alerts because you will get an email every time we open a new funding opportunity. Next slide, please. So this has been a lot of information. So here's a link to some of our resources. And again, we're recording this, so if you miss anything, you can go back to the recording and view this. You see a link to Culture of Health, which gives you an overview of our Culture of Health goals and measures, a link to the Culture of Health Prize, a link to a page that includes more information about our leadership and research programs, as well as the program finder. Finally, if you're looking for funding opportunities, if you go to rwjf.org, the main landing page, you will notice a button that says About Us, and if you hover over it, it will link to you can click through to funding opportunities. So with that, next slide, please. We are happy to take your questions now. Just a reminder to press *1 on your keypad to ask a question, or use the chat feature to send everyone a question.
At this time, I would like to remind everyone, in order to ask a telephone question, please press * and the number 1 on your telephone keypad.
Beth, I wanted to have a follow-up, and thank you for that robust presentation about what we're doing at Robert Wood Johnson Foundation. I think people know, affiliated with the Action Coalitions, that if you have any ideas, if you have any questions about funding or where to go for funding or how to make the ask, you can reach out to me. You can reach out to any of your liaisons at CCNA. We're always here to help you. This is one foundation. We do a lot, but there are a lot of foundations in the country and a lot of places to look for money. So we are here to help you do that.
And again, if you'd like to ask a telephone question, please press star then the number 1 on your telephone keypad. And there are no telephone questions at this time.
Thank you, everyone, for your participation. And again, call us if you need us, and I hope that this has been helpful for you.
This concludes today's conference call. You may now disconnect.